poor, the state is the best place to determine what's the best way to help those poor. And so I would therefore block grant to the states Medicaid funds and so-called DSH payments, disproportionate share payments, and other medical payments to the states, and say, states, you now use these monies as you feel appropriate to care for your own poor. I'd limit the federal standards to those that were absolutely necessary. States, of course, will experiment and learn from one another, and they'll have flexibility to deal with the uninsured in the way they think best. Some will decide that they want to understand the role of charity in their state and can it be expanded. Others will say, let's put in place exchanges like we did in Massachusetts. Some will decide to give subsidies for private coverage. There'll be different alternatives chosen. There'll also be flexibility to deal with the chronically ill population with high-risk pools or reinsurance plans and risk adjustment. These ideas will be tried out and are now being tried out by various states. Of course, until Obamacare got passed, at which point most of that got put on ice because obviously the federal government was taken over. Second point, empower individual ownership. I think this is critical. I would make sure that we give the same tax treatment to individuals who buy insurance that we give to individuals who get insurance from their big employer. Now, what would that do? In a lot of cases, an individual is going to say, you know what, General Motors or Ford or Chrysler, I have to be fair here, instead of taking your plan, I want to buy my own plan. So you give me the amount of money that you're paying for Blue Cross Blue Shield here, and let me pick my own plan from Blue Cross or from anybody else I want. And when that happens, you're going to find people choosing plans that fit their needs rather than plans that have been put in place by the Human Resources Department of a big corporation. This gets greater consumer choice so that people can buy what they want, not just what their employer wants to give them. It promotes, of course, portability. Why is that? Because if I own my own health care insurance, I don't lose it if I change jobs. I'm continuously insured as I go from job to job. And of course, by virtue of that fact, and the fact that I'm choosing what I want myself, not just what is given to me, the cost of health insurance in the choices that people make, in my view, is likely to come down. Focus federal regulation. We've got to make the markets work better. A couple of common failures I'd go after. Ensure that individuals with pre-existing conditions who are continuously covered for some specified period may not be denied coverage. So you're not going to say to somebody, if you've never had insurance and you're age 55 and suddenly you have a heart attack and now you want to buy insurance, you don't say to them, oh fine, you get it. That doesn't work very well. You say instead, if you've been insured for 10 years and you have a heart attack and you've changed jobs, because of that continuous period of insurance, of course you will continue to be covered. Empower individuals and small businesses to form purchasing pools. Eliminate some of the counterproductive federal constraints, removing barriers to the sale of insurance across lines. Let people buy products from other states if there are superior products in the consumer's view. And of course, allow providers to design plans, insurance plans, that meet the needs of consumers across state lines. Reforming liability. I don't have to tell you about the burden of our medical liability system on our healthcare system. We should cap non-economic damages in medical malpractice lawsuits, and we should provide innovation grants for state reforms like health courts, alternative dispute resolution, and so forth. Market forces. I'd like to make healthcare work more like a market and less like a government agency. I'd like to make health savings accounts, which really empower the consumer, far more efficient and effective by such things as permitting health saving account funds to be used to pay the insurance premiums, which isn't allowed today. I also like some of the new innovations in insurance, like co-insurance. And we were talking earlier with the members of the team here about value-based insurance products, where co-insurance, for those that are not familiar with the term, we've all heard of co-pays, where you pay, let's say, $10 for an office visit. Co-insurance would say, I'm going to pay 10% of my total bill. Now, when that happens, I as a consumer care how much that total bill is going to be. I care about the quality of the provider and what the total bill is going to be. And that kind of product, I believe, would lower the premiums and give people a much greater stake in thinking about the cost and quality of the care that they're seeking. I like the idea of a Consumer Reports type approach, where Consumer Reports itself or others like it would rank different insurance programs around the country, which ones provide the best coverage for the best value. I'd like to facilitate information technology interoperability among providers and establish cost and quality transparency And finally, I know a number of you are already doing this in the health community, but promoting alternatives to fee-for-service with capitated rates or bundled payments, I think, has a lot of promise. So where are we with regards to my objectives? I think we've done what I suggested at the beginning. We haven't done harm. I think we've strengthened health care, and we've expanded health care to those that don't have it. Let me mention a little more on health care cost. How do we get health care costs down? Well, one, we for the first time allowed individuals to purchase insurance as an individual without being penalized on a tax basis. Two, we're going to introduce market dynamics where consumers care what something costs, as I just described. We're going to reform the medical malpractice system to keep the cost down of defensive medicine. Providers will have an incentive in the non-fee-for-service-based approach that I've described for quality, not just quantity. Medicaid ceases being an open checkbook for states to say, I'm going to expand more and more people on Medicaid because I know the federal government picks up half the bill. And finally, there's going to be greater competition across state lines as people are able to buy insurance from other places and join into purchasing alliances. Now, let me note that there is more to come. That there are additional specifics that you expect from me, and they'll be coming. I also note that there's going to be a lot that you're going to expect from me on Medicare reforms. And that's a big part of health care. Will have an enormous impact on the overall system. Let me just make a couple of points. One is I applaud the fact that Representative Ryan put forward a plan to keep Medicare solvent. That's got to be our primary objective. And to keep our country fiscally solvent as well. And he's also added choice to his plan and inserted market dynamics. And I'll note that while I haven't introduced today my own plan, will in the future, it's not going to be identical to the Ryan plan, but it shares many of those same objectives. Now let me conclude by summarizing differences between the output of President Obama's plan and my plan. And as you might imagine, the comparison will be favorable in my direction. First, Obamacare raises taxes. I don't. He diverts Medicare for Obamacare. We do not divert Medicare for a health care plan. His creates massive new federal bureaucracies. Mine creates no new federal bureaucracies. His reduces consumer choice. I dramatically increase consumer choice. His, I believe, will raise health care costs. Mine lowers health care costs. His involves massive new government spending. They admit to $1 trillion over a decade. It'll be a lot more than that down the road. Mine reduces government spending. His includes mandates on individuals, on corporations, and on states. Mine includes no mandates. We let the states create their own plans. His is dependent upon the federal government deciding who's poor and how to insure them. Mine gives the state the responsibility to care for those that are poor and uninsured. His discriminates on a tax basis against individuals and small businesses, by the way, where individuals often don't get coverage from their employer. Mine provides for tax fairness. And in my view, his includes overly broad pre-existing condition rules. Mine has, I think, fair and reasonable pre-existing elements. I like what we've worked on and put together. If I am the nominee on the Republican side of the aisle and I get the chance to debate President Obama, this is what we're going to be talking about. Who has a better plan for America? Which list is a more favorable list to the American people? And I'm confident that when considering those two plans, the American people will say the Mitt Romney U.S. reforms, that's a lot better than Obamacare. Thanks so much. Good to be with you today. Thank you.